Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Okay, post-gastrectomy or post-vagotomy syndromes. That is, what are the complications after gastrectomy and after vagotomy? So, complications after gastrectomy or after vagotomy can be divided into three types. One, those complications which occur after gastric resection. Complications after gastric resection are dumping syndrome and metabolic disturbances are seen mainly after the gastric resection. Then, secondary to the gastric reconstruction. Complications secondary to the gastric reconstruction are we have afferent loop syndromes, efferent loop syndrome, alkaline reflux gastritis, and retained antrum are the complications secondary to gastric resection. Then we have complications which are post-vagotomy syndrome. After post-vagotomy, after doing a vagotomy, the complications which we see are in the post-vagotomy syndrome, the patient might develop post-vagotomy diarrhea. That is, the patient develops diarrhea after vagotomy. The patient can develop post-vagotomy gastric atony, and the patient can develop post-vagotomy vagal resection can occur. Post-vagotomy vagal transection can occur in the patient. Okay, so these are the complications of post-vagotomy or post-gastrectomy, which is called as post-gastrectomy and post-vagotomy syndrome.
thank you and thank you for watching.